what led you down the road of burnout in particular into this space?
So, I've gone to school for 15 years on top of high school, and you end up learning through all your schooling. You meet these wonderful mentors, colleagues, and professors that do fascinating work and inspire you to become like the best clinician you possibly can by having different tools under your belt. And I've been fortunate to have fantastic meditation teachers as well as clinicians to teach me different ways of treating mood, anxiety, stress, and trauma. And during my path, like I started psychology and working in the field of psychology since I was a teen, since 16. So I was very fortunate to work with abused women and children, with women in prison, men in prison, Center for
Hmm.
Addiction and Mental Health just with anxiety disorders, Lake Ridge Mental Health Center with children and families with anxiety, UHN with brain and spinal cord injury. Lots of work with those populations of mood, anxiety, stress, and trauma, 9/11 responders, military work. So lots of work in these extreme populations, which also then teach you how to work with everything in the middle. But when I meet these phenomenal professionals, the best question I used to ask them is, how do you maintain balance?
Hmm.
All of us show up with a good heart. We enter the fields with that humanitarian effort of wanting to help people be the best version of themselves, as well as we train ourselves. We're also trying to be the best version of ourselves so that we don't burn out and we don't get sick as we're healing others or helping others, right? And so,
Absolutely.
throughout my journey, I've been very fortunate to learn meditation when I was a very young kid, about age 10, through family and culturally, I'm East Indian by background, so I had a lot of
Hmm.
meditation teachers. So I've always had meditation as one of my coping mechanisms throughout my life, but you always fall off of good habits when life is going well or it gets too busy. And I think as thriving new professionals, many of us start sacrificing self care and try to climb that corporate ladder or try to be good in our jobs by sometimes self sacrificing and self sabotaging by not maintaining the things that keep us healthy. So, I've been fortunate to have just the right mentors, but I've always asked since I was a young age one specific question: how do you maintain balance? How do you maintain like health? And a lot of my well esteemed professors, mentors, colleagues, bosses, and supervisors never really had a firm answer of this is what I do that really works for me. All of them were trying to stumble around, trying to figure it out because we were ambitious, we were academics, we were, humanitarians that wanted to help, and our heart was big, and we were trying to be everybody's everything.